Ankle-foot orthosis, AFO. Continuing education for medical professionals. AFO. This is an acronym that stands for ankle-foot orthosis. The definition of orthosis is a device as a brace or splint for supporting, mobilizing, or treating muscles, joints, or skeletal parts which are weak, ineffective, deformed, or injured. Merriam-Webster. A collaborative approach, basis for this continuing education segment on AFOs. As a healthcare professional, you are seen by patients as an expert in more than just your specialty. A person from the nursing team, or the physical and occupational therapy team, or even a physician assistant are always asked to do more on a regular basis. As a result, we have to adapt to certain scenarios that are beyond what we're initially taught in school. Among these extra services that medical professionals are asked to do comes the topic of orthotics and prosthetics patient care. For example, there are many instances when a health professional will be called upon to give their input on an orthotics/prosthetics patient care scenario. In specific, medical professionals other than the orthotist or prosthetist are asked to adjust a brace, or perhaps help order one for a patient. Additionally, you may be even asked by the patient to simply help them apply their AFO so the patient can start their activities of daily living. As stated earlier, as a medical professional in the room, the patient sees you as the expert that knows how to help them in many different ways. Knowing your options as a health professional is very important when the patient is asking you to help them, or when one of your colleagues is asking for your advice on how to deal with an AFO situation. This video will share important information with you to help you and your patient take better control of what you want when it comes to orthotics and prosthetics. You definitely have a choice when it comes to this topic. The information contained here in this video will help medical professionals to 1. Clearly explain the things you want from an orthotist, brace provider. There are more options available to you and your patients than you may be aware of. 2. Get the best team outcome possible when you're assisting a patient with their AFO. Let's talk about this in more detail. Benefits of this course for medical professionals. 1. Review statistics that relate to falls and ambulation. 2. Review the different general types of orthoses for the ankle and the foot. 3. Learn AFO general instructions and application basics. Learn the #1 safety rule for your patients with AFOs. Learn how to overcome challenges with AFOs and shoe application, and you will learn to help your patients do the same. 5. Take a virtual tour of how thermoplastic AFOs are made. These are the ones that are most commonly used. Many healthcare professionals have never seen this rare footage. This will help you better understand the orthoses you work with on a regular basis. 6. Understand how the height of an AFO affects your patient's knee, foot, and ankle when they walk and stand. Understand the AFO design choices available to you and your patients. Learn how to ask for the exact design you want from an orthotist. 8. Learn how to address plantar flexion contractures with an AFO. 9. Learn how to address a tight shoe fit with an AFO. 10. Have you ever had a hinged AFO make that clicking sound when you were with your patient? Learn about an effective method to help reduce noise and increase compliance for your patients. 11. Learn how to stop excessive in-toeing with AFOs so your patients don't trip when they walk. Learn about how AFOs help patients with balance issues. This course was designed for the following medical health professionals: physical therapists, physical therapy assistants, occupational therapists, occupational therapy assistants, registered nurses, advanced practitioner nurses, certified nursing assistants, and physician assistants. Statistics that relate to walking and falls. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of a broken hip or head injury. Every 11 seconds, an older adult is treated in the emergency room for a fall. Every 19 minutes, an older adult dies from a fall. Falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions among older adults. Many of these falls could have been avoided if the patient had more control over their postural sway. This includes helping to control balance in the sagittal and coronal planes via the knee, ankle, and foot. Walking problems and falls. What medical professionals can do about it. Walking problems are not uncommon. As health professionals, we already know this to be true without being shown statistics. To help better the situation, we can make a difference with the use of therapy, for example, to decrease fall rates, or by the products we order for a patient. These products typically include ordering a cane, two-handed walker, or an AFO. Orthoses for the ankle and foot. CAM walker stands for controlled ankle motion. The indications are fractures or sprains in the foot or ankle, as well as Achilles tendon injuries, used for immediate support and motion control. Considerations: pretibial shell addition to help avoid impact from objects that may fall and to improve motion control. Ankle foot orthosis, a thermoplastic type. Indications: used for foot drop, foot and ankle instability, and indirect support for the knee, which is a secondary effect. Its design choices include solid ankle, with or without a pretibial shell, rigid, semi-rigid, flexible, articulated, pre-articulated, and tibial fracture type. A CRO. This is an acronym that stands for Charcot Restraint Orthotic Walker. Indication: this orthosis helps to distribute pressure equally throughout the leg and foot when an individual is challenged with Charcot foot. The CRO helps to remove excessive forces and give the foot time to heal. The design includes a clamshell, a rocker bottom, and a soft interior. Another AFO type is the leather and plastic gauntlet. Indications for this are posterior tibial tendon dysfunction, talocalcaneal varus or valgus, severe pronation or pes planus, ankle arthritis or degenerative joint disease, chronic Achilles tendonitis, and balance issues. This AFO is designed more for people that have balance issues and pain in their foot and ankle, more so than it usually is for a foot drop. Metal and leather ankle foot orthoses. Indications: they're used for foot drop, foot and ankle instability, and indirect support for the knee, which is a secondary effect. Frequency of use. They're not very common. However, they definitely do exist. Primarily, they're used for patients with extreme edema fluctuation, such as a diabetic patient that needs a lot of space around their ankle or lower leg. Or they're used for a previous user who prefers this style of AFO. The short articulated ankle foot orthosis, which has free motion. Indications for this are posterior tibial tendon dysfunction, ankle arthritis, ankle sprains, chronic ankle instability. Carbon graphite ankle foot orthosis. Indications are foot drop, and it may also treat knee buckling indirectly. Some designs come with an anterior shell and a trimmable forefoot. The advantage of this is that it's lightweight. It is also a prefabricated orthosis. Pressure relief ankle foot orthosis. The acronym is PRAFO. Many people also refer to it as a multi-POTUS boot. The indications for this type of orthosis are: it helps to prevent foot drop and heel sores for bedbound patients. It has treads so the user can walk with it, but this is not designed for great distances. The design has a pivoting lever in the posterior aspect of the PRAFO that will help keep the foot and ankle at neutral. AFO general instructions. Application basics. Seat the heel inside of the AFO or shoe if the shoe is attached to the orthosis, such as with a metal AFO. This is true unless there is a barrier to this process of seating the heel, such as a plantar flexion contracture. All straps should be made snug. A loose brace does not do your patient any good.